Oh.
Yeah, that's the relax. Good job.
Oh my God, holy.
Hey guys, welcome to Hometown Integrated Medicine. This is Dr. DJ Ingham. I'm here with my patient, Kristen Jacobs. I've been seeing Kristen for a couple years now, and we're actually due for our established yearly re-exam. So we're gonna kind of start with that, and I'm gonna get a quick subjective on her, kind of ask her what's going on. We'll, our basic re-exam, we'll kind of test her neurology, look at her range of motion, do some vital signs, and kind of see if she's healthy and ready to go for some good old adjusting. So you were telling me your elbows, because we smacked one of those the other day.
Yes.
Okay.
Right after an adjustment.
And then you were talking about like upper shoulders?
Yeah.
Okay.
Where I keep holding my stress.
Sure. Kind of trap tightness going on?
Yes.
Okay.
Yes. I did accidentally, or enjoyed a, oh, hey, that was there. Like, just kind of
Cool snap.
Yeah, a deep breath, relaxing with my hand, like, kind of cocked yesterday, and it just...
Release some stuff?
Yeah, it was nice. So you might need to straighten some things out.
Well, we can do one or two of those too. Let's see if we can snap something and release some things also. Now, how's your your knees doing good? Low back? We've worked on those before.
I would need some. Yes.
Check the knees out. Okay.
Mm-hmm. Knees, lower back.
Okay.
The hips might be a little, just because of driving, but.
Okay. You've been playing golf still, or is that kind of winding down?
Yes, but not in the last 2 weeks.
So not a ton of twisting going on.
Correct.
This time.
Yes.
Okay.
Yeah.
Well, let's check the elbows, knees, and then kind of upper, lower back, spine, everything in between. Have you standing straight ahead, looking at that mirror again for me. And I'm gonna do a quick just check out which shoulder's higher on us. Do a little posture assessment on you.
I'm glad you said that.
Check out the hips too.
I don't know if it matters, but my right is like pointed, peeking up more.
Yeah.
Than my left.
Interestingly enough, you got a right high hip going on bony-wise, and then you actually have a left high shoulder, but it doesn't mean that this isn't getting like compressed and pulled and that your levator may be poking out a little bit more. But as far as like your clavicles, can you kind of even see when you're looking in there that one's a good bit higher than the other? This guy is about a ½ inch or so.
Yeah.
And then I also check like these AC joints, so you kind of got to look at the bony processes. And can you see that too? Just a little bit higher. But interestingly enough, this is much more even than up through here. So we know that a lot of the tightness is coming from like deep towards the spine.
Okay.
Rotationally, not doing too bad, Miss Kristen, as far as having a really rotated pelvis. Pelvis a little bit more, but your neck's pretty straight away. We just got to get rid of this like tilt a little bit. And I'm going to make a couple notes of that, but let's head out to that table again and we'll check your nerves and stuff. And it is so common that the opposite, the higher the other hip, usually the opposite shoulder, and that's kind of how we like balance each other, you know, or balance things out.
If we're offset,
yeah. The upper kind of balances out the lower. Let's start with just a good temperature on you, Miss Chris, and I'm going to just shoot this right into your forehead. It's going to get like a laser reading on you.
Ouch.
It's a lot easier than having to shoot that thing under the tongue like we did back in the day.
Ow.
You were kind of 98 on the money there. Ow, you said with the... In case you guys, you don't even feel that at all, just so you guys know.
Lies.
Let's check out that pulse for you, Kristen. Nice, strong pulse. Every time she breathes deeply, she actually slows it down naturally, which is interesting, because we can control our heart rate, that's for sure. We're a little bit higher than a beat per second, roughly about 70 beats a minute. Not bad at all.
It's probably from moving back and forth and talking.
When you might have started about 75, 80, and then when you started breathing, it slowed down. So it's good stuff.
I try to be able to.
Good strong pulse too. No weakness. No flutters in it. No lack of getting down to your distal extremities, which is a good thing. Let's check your blood pressure out too, Miss Kristen.
Same side.
Yes, ma'am. We can kind of go either or. Let's check out this right side. All right. And don't flex those muscles too hard. We'll pop right out of that thing.
I might just.
I think your arms are bigger than mine, Chris. And you're jacked.
I appreciate that, but.
Blood pressure's looking pretty good too, Kristen. Let's see right where that's gonna end. You were about 120 over 75.
What, 120 over 80 is normal?
Is that kind of the average normal? Your diastolic was a little bit even lower, which is a good thing. As long as it's not incredibly low, then it gets tricky.
As long as you don't type me with heavy, I think
No, we'll be all right. Let's check out your range of motion real quick.
Okay.
And then we'll get into the nerves a little bit more.
Sweet.
So if I could have you just kind of flex your neck kind of back and forth for me, Kristen. Extension's doing not so bad. Flexion's a little bit tighter, huh?
Trying to go all the way. Yeah, it's even more there. I can feel it coming all the way down into shoulders and even further down.
When you extend, you really feel the pinching?
Yeah. Okay. Well, it's more like in the blades. Mm-hmm. All the way to, yes, and it's coming all the way. I can feel it more back that way than forward, which is interesting.
Okay. Let's have you rotate your neck kind of.
You should too.
Crossing that way. Okay. We're not liking that left as much. Now let's have you bending your ears to the shoulders too, Kristen. Okay. Heard some kind of crack a little bit. We definitely got to get our left motion going a little bit more.
Never know if you guys can actually hear that. It's so close to this, like the skull. I just think it's up there.
Have you just kind of rotate your thorax too for me? Okay.
This is nice.
And then best you can, Miss Chris, I know you're pretty flexible. Can you touch your toes for me?
How far down do you want me to go?
As really as far as you can without losing. Perfect, Kristen, like crazy good flexion there. Now go all the way the opposite way if you can for me and do like extension. Yep, kind of leaning back. And I'm just here just to support you. Yeah, yep, okay. Best you can.
Like, I mean, all the way over.
Oh, if you're gonna do it all the way over, then we're already at like 100%. I don't even have to check. That's pretty good extension there.
I mean, I can go
Not
further.
bad, Miss Chris.
Okay.
No, that's perfect. That's perfect. And then I just want to see kind of bending side to side if there's a little more sticking on one side than the other. Not doing too bad, Kristen. If anything, it's a little tighter on that right where our hip's a little higher, huh? But man, pretty great range of motion down low.
I need cowbells.
Get some
go bleak crunches in there.
Yeah.
Well, might as well.
Well, if you sit right like you're doing, Miss Kristen, and then let's check your nerves real quick, and then we'll be all set to get you treated. No, you're in a perfect spot. We're just gonna check these patellar reflexes a little bit. Not doing bad on either of those. Achilles is doing pretty good too. This one's a little bit decreased, but not doing too bad. There we go. Now let's check that. There we go. There we go. And a little bit more reflex on that side too. No extreme decreases in reflex. We just got a little more compression on our left leg side and then our right side of our neck. Okay. All right, now we're gonna do that motor testing, kind of just check the strength and everything. You're gonna be pretty strong everywhere, Kristen, so it might be a little harder for me to tell what's weak, but I'm gonna do it kind of in comparison.
Okay.
Now, if you feel like something's incredibly weaker than it normally is, you kind of let me know.
Okay.
And then if anything hurts really bad too, kind of let me know about that too.
Okay.
Push these toes towards the floor for me, and then press them towards the ceiling for me. We'll do the same thing on this side, just down and then right on up. Pretty good there. Kicking out towards me, pulling right back towards you. Kicking out this way, and then right back towards you. Bringing these knees together, Kristen, and then spreading them apart for me. And then lift this knee up towards the ceiling. Does that hurt your low back at all? You feeling that anywhere?
No.
Good. How about on this side, Kristen? Feeling that down low at all?
No.
Okay. Spreading those fingers wide for me. And then like you're revving a motorcycle for me.
And the clicks.
Doing really good there. Nice curl towards you. Good job, Kristen. And then pressing towards me. Nice. Last one, a nice shrug, Miss Kristen. Any of those crazy painful when we were working through them?
It's just a little stiff when I come up. It's like pinching stuff.
Okay. Okay.
Like it gets a little extra like tighter up in this area. Like not quite sharp, but like borderline, like just past dull, if that makes sense.
Totally. Something's wanting to stab a little.
Yeah, something's
Pinch
yes,
a little.
yes. Like borderline pinch, like sharp pinch.
The function and all the musculature was there, so we got some pretty good nerve flow going on, but we definitely got some postural things pinching on things here and there.
Yeah.
You can kind of tell too when I was doing a little bit of that hip flexion, that some stuff wanted to pinch down low.
Yeah.
Between those two, as far as like your, activation of your hands and feet, really good, Miss Kristen.
I can tell things are getting tighter and stiffer in like the palm and like my thumb areas, like around in here. They're just getting like more sore. So I mean, I'm trying to massage them more at night and things like that. But I mean, other than that, and like trying to stretch them out. But
I'm gonna check the joints in that area.
I mean, it's probably just work.
So what happens
just
over
like
a long time
tenderness
of if we get pretty progressive hand arthritis is sometimes the thenar pad starts to kind of atrophy on us.
Yeah.
But let's just see to make sure these guys are moving good on you.
Oh.
Yeah, that's the scaphoid. We needed that one a little bit. Your thumb's moving great though, the actual metacarpals and stuff. That's moving really good. It was this guy up in here.
Yeah.
Let's see if it's the same on this side. Good job, Chris.
Yep.
That guy needs a little more, actually. I'm gonna really pull this towards me, Kristen. There you go. Good job. There we go, Kristen. And that'll help for sure
some
too.
marbles.
Yeah.
Oh wow.
More in the wrist than in the actual thumb joints, which is good. So we got those moving for you.
I can feel it, just like it's like floodgates just start going.
Feeling your thumbs.
The flow, the
Nerve flow.
energy. Yes, thank you.
For sure.
Yes, absolutely. It feels
No
like
worries.
water moving.
That's like a big part of our gig and our job is opening that stuff up.
I know I'm like maybe extra sensitive in those areas and can feel it, or I don't know if it's just me or if everybody can, but I like to know that, hey, that works. It opened it up. It's flowing like it's supposed to now.
Well, and from like a mental standpoint too, when you think about it, like, if you're in your backyard, like pinching a hose off,
Yeah.
and then the moment we let it go, the water shoots out like crazy.
Yes.
When like that initial opening of the flow, we really mentally like feel more than anything because we've had that pinch in the hose.
Yes.
Now, when there's sometimes even like a slight pinch, and then it's even like less of a release when we think about it more. When it's like fully pinched off and you finally get that flowing, there's an immediate connection and you like feel like crazy.
Yeah.
And then we like over time start to even lose track of what's, you just kind of naturally start to feel things.
Yeah.
But that first moment, the hose gets
Yeah.
unclamped, boom,
Gosh. Thank you.
No problem. Take your time, Miss Kristen, but let's go start doing some extremity and spine work.
Do your FaceTime.
Let's actually start with your elbows,
Okay.
getting those in first,
Yeah.
and then we'll go face down. And I'm usually using this table only because it makes things so much faster, and this will be a lot more enjoyable than doing it manually. So, because we've done it manually before, and they've been a little bit tender. So, Kristen's gonna hop on a knee there, and we're gonna kind of arc this into the drop piece a little bit. Now, elbows and knees tend to be kind of the most tender ones sometimes to get aligned, so we're gonna take our time. There we go. Good job, Kristen. Let's see this guy too. There we go. Kind of usually radius on both sides of Miss Kristen. There we go. Take your time. Can I check these ulnas out a little bit too for you? Okay, let's see that other one. Yeah, it's normally these upper dudes that are getting us.
Yeah.
I want to do one little trigger here though, Kristen. You're just going to kind of supinate your hand for me. Kind of do that a couple times for me. There we go. Good job, Kristen. 2 more. There you go. You felt that little crack in there? That's what I wanted. I wanted it to reapproximate itself a little bit. And a lot of times when it comes to knee pain, we're always kind of checking out tibial torsion before anything. Because that's the main big weight-bearing bone, and that's usually the one that likes to get out on us. But sometimes it can be a little bit of our fibula too, like on that right side. up this joint a little bit more. There we go. Yep. That one really went. Good job, Kristen. Good job. Good job, Kristen. And one more. There we go. There we go. This one might have wanted even a little bit more. Is that the one that was bugging you more, or kind of more the right one? Is the right one? There might have been a little more out even on the left, but they both wanted them a little bit. It is interesting sometimes which joint, when it comes to bilateral stuff, which joint's stickier and then which one we like feel more. And it's not always the same one.
I usually lead with my right, and if I'm lightly injured on the left, I'm going to overcompensate on the right.
Totally. Sometimes that compensating one, the one that's working harder, is the one that tends to stick a little more. Good job, Chris. There we go. Get a little more rotation out of there, Chris. There we go. Aspect in there. And we're looking a lot more even, Miss Kristen. You doing okay, Kristen?
Yeah.
Nice big breath like you did there, Kristen. And how relax that area. Good job. Good job. There you go, Kristen. Good job. There we go. Good job, Chris. I'm checking a lot of the ribs around these areas too. Nice big breath here, Kristen. All the way out for me. Good job, Kristen. Good job. Good job. Good job. Keeping that neck nice and relaxed for me, Kristen. We're going to get some release out of these shoulders.
Oh my God, holy I'm sorry, that went all the way.
You're good.
God.
That had to be messing with your trap tightness.
Oh my gosh.
You're good, Kristen.
I feel it on my fingers.
Good. Opening these up a little bit.
Yes.
Yeah.
Even on my toes. Holy crap, that's going.
Take your time, but this one's twisted a little bit the other way, so we're going to do the opposite a little. There you go, Kristen. Good job. There we go. You're,
Get out of your way.
no, you're looking good, Kristen. No worries. All good.
It's like it's opening up everything all the way down to
You're feeling all this stuff through here?
all the way down, all the way down to my lower back tail.
Good. Yeah, that one we did with the big pop is a good way to release the levators through here. That's for sure.
Like I had everything screaming down there.
Doing better?
Oh yeah.
Good. Take your time, Kristen, but we'll sit up in the chair next. There we go, Kristen. Really relax that. Good job.
Oh
Good
my
job.
God! Holy.
Good job.
Sorry.
You're good. No worries. No worries.
Sorry, that was.
That's gonna help a lot with
very
that.
loud and yeah,
Yeah.
that was
We needed that bend in there, that lateral bend.
holy crap.
Take your time, Kristen. No rush. There you go. Just a little click right in there. Yeah, we can't miss up there. Yes, ma'am.
It's like you feel the like where the nerves channel. I think depending on how in tune you are with your body, you can feel it.
You have that especially too, Miss Kristen, because you're very in tune with yourself and you stay in good shape and you really feel this stuff out.
Try to focus on, or at least listen to it.
I'd like you to kind of mimic a shoulder press for me. And now push through me, Miss Kristen. There we go. There you go. Do a couple more of those for me, please. Feel that shoulder blade kind of articulate itself in there. There we go. One more, Kristen.
Damn, something clicked.
Yep, one more. There you go. Let's do a couple of those on this side too. There we go. Good stuff, Kristen. All that clicking's coming from your scapula, Kristen. That's really getting the levator scapula triggered like that will help that move into place better. Let me do a little bit of cupping on you.
I did mean to ask you if you, I forgot to mention about like my feet and just the like this what's that big knobby part that in the metatarsal. The left one, I think the left one hasn't been as achy, but I'm trying to like press up, like extend off of it. The other, I think I'm walking awkwardly.
Okay. Let me check that here in a second for you too, Kristen.
Or I just need to learn how to walk on my toes better, or walk on my feet better, instead of cinching on my toes. I've been able to adjust certain things by recognizing certain areas, especially of treatment that we've been having to do over the last couple of years, to where it's not, I mean, it's still something that I'll need to have adjusted, but it's not something that is as painfully bothering me as much as what it was, like disruptively bothering me.
By utilizing kind of a different form.
Yeah. Recognizing how that continues to get disgruntled, I guess, in a sense.
When it comes to the foot and toe world, that's massive too. Normally, a lot of problems and solutions when it comes to our feet have to do with like the style we're walking, how far, what shoes we're using, you know. Take that big toe and flex it toward your head, Kristen. There you go. Let's do a couple more of those. Nice and slow for me. There we go. Flexing all the way towards me, and then nice and slow. There we go. Good job, Kristen. more deep one, Kristen. There we go. One more, I lied, I'm sorry. There we go.
That's fine. I don't mind the deep tissue work. It just, you're going through the pain to relieve something.
Your toe joint's moving better today, that big toe
Yes.
joint. There's just a little bit of that fascia up through there, especially where that tendon hooks into your heel.
Awesome.
And we worked that out for you, Kristen.
Thank you so much.
Let's let the cup sink in a little bit more, and then we'll be all set.
Sweet.
Okay, so now that we're all done with our exam and treatment for the day, I just wanted to thank Kristen for letting us film you. We really appreciate it. And we'll keep taking care of you best we can.
Hey, I appreciate it.
No worries, Miss Kristen.
Grateful. Thank you very much.
Thank you very much.
No,